After 60, your mouth is not the same mouth you had at 30. So before you chew another clove, there are a few things worth knowing. The clove may not be the problem. The way you are using it may be the problem. And I understand why cloves feel so safe. They are small, they smell warm. They remind many women of an old kitchen cabinet, a mother's remedy, or a grandmother saying, just chew this, it will help, for toothaches, for breath, for a nervous stomach, for that heavy feeling after a meal. But we have to be honest here. A powerful spice is not the same thing as a harmless breath mint. When something is powerful, the amount matters. The timing matters. Your gums matter. Your teeth matter. Your medications matter. And after 60, your mouth may not respond the same way it did at 35. That does not mean cloves are bad. It means they deserve respect. The mistake is not using cloves. The mistake is treating cloves like something you can chew without limits. That matters especially for women over 60. At this age, the mouth is often drier. Gums can be more sensitive. Crowns, bridges, implants, dentures, and older fillings are more common. And many women are taking medications that may affect saliva, bleeding risk, reflux, or stomach comfort. So when someone hears that chewing cloves may support fresh breath, digestion, or calm after eating, the thought is easy. If one clove helps, maybe two will help more. If using it once in a while is good, maybe using it every day is better. That is where the problem begins, not with the clove itself, but with the belief that more always means better. For women over 60, cloves should be treated like a small after-meal ritual, not an unlimited daily habit. There is real physiology behind why chewing matters. Taste, smell, chewing, and saliva can send early signals to the body before food is fully digested. Your mouth is not separate from your digestion, but that does not mean you should overdo a strong spice. It means you should use it carefully. Think of your mouth like the front porch of the digestive house. Before anyone even walks into the kitchen, the porch light turns on. The door opens. The house starts getting ready. That is what aroma, taste, chewing, and saliva can do. They tell the body something is coming. Your salivary glands wake up. The nerves in your mouth start sending messages. Your stomach pays attention. Your digestive system begins to prepare. This is part of what researchers call the cephalic phase response. It helps explain why a whole clove is not just a tiny piece of spice. It is a strong sensory signal. Cloves contain eugenol. That is the compound behind their warm smell and strong taste. But the same strength that makes cloves useful can also make them irritating, especially in the wrong mouth, at the wrong dose, or with too much repetition. A porch light is helpful when it guides you home, but if that light is too bright or left on all night, it stops feeling comforting. It becomes too much. That is the balance we are keeping today. Not fear, not hype, just respect. Number 1, chewing too many cloves. This is probably the most common mistake. A clove is small, so people assume it is harmless. But small does not mean weak. One whole clove has a strong taste because it contains concentrated aromatic compounds. When someone chews 2, 3, or 5 cloves in a day, the mouth gets repeated exposure. Some people may feel fine, others may notice burning, dryness, stomach upset, or gum irritation. So do not turn cloves into a contest. You are not trying to prove your mouth is tough. If you are going to try it, one softened whole clove is enough. That is a trial, not a challenge. Number 2, chewing cloves every single day. A daily habit sounds disciplined, but with cloves, daily does not automatically mean better. The body often responds better to rhythm than pressure. If your goal is fresher breath or a little after-meal support, occasional use may be enough. There has even been a published case involving a 6-8-year-old woman with burning mouth symptoms who had exposure to eugenol mouthwash and daily clove chewing. Her symptoms improved after stopping those eugenol exposures. That does not mean cloves will cause burning mouth in everyone. It means sensitivity is real, and you should listen to your own mouth. A good ritual should leave you feeling better afterward. Not Rav, not irritated, not like your mouth has been punished. Number 3, chewing dry, hard cloves with fragile teeth. Dry cloves can be tougher than they look. If you have crowns, implants, loose teeth, older dental work, dentures, or gum tenderness, chewing a hard clove may not be worth the risk. You are trying to support your mouth, not test it. A gentler method is simple. Place 1 whole clove in warm water for a few minutes. Let it soften. Then chew slowly. If it still feels too hard, skip it. There is no prize for forcing your teeth through a spice. Number 4. Using cloves for tooth pain instead of dental care. Cloves have a long history with tooth discomfort, and eugenol has been used in dentistry in specific forms. But chewing a clove is not dental treatment. If you have tooth pain that lasts more than a day or 2, pain when biting, swelling, fever, a bad taste, or tenderness in the face or jaw, you need dental attention. A clove may distract from discomfort, but it cannot tell you whether there is decay, infection, gum disease, or a cracked tooth. Food can support the body. It cannot replace proper care. Number 5, ignoring mouth sores, ulcers, or burning. If your mouth is already sore, cloves may be too strong. That includes canker sores, raw gums, burning mouth, fresh dental work, or irritation from dentures. Eugenol can feel warming, but on irritated tissue, warming can quickly become stinging. So keep this rule simple. If it burns, stop. If your mouth feels worse afterward, do not push through. Your mouth is not being weak. It is giving you information. A good food ritual should feel supportive. It should not ask you to tolerate pain. Number 6, treating clove oil like whole cloves. A whole clove is not the same as clove oil. Clove oil is concentrated. That means the exposure can be much stronger. Putting clove oil directly into the mouth, especially undiluted, can irritate tissue. So be careful here. Not drops of essential oil in the mouth. Not rubbing strong oil onto the gums. Not swallowing concentrated oil. Whole food and concentrated extract are not interchangeable. They may come from the same plant, but they do not behave the same way in the body. Number 7, missing the saliva benefit. Now let's talk about what may actually be helpful. Chewing slowly can increase saliva, and saliva is not just water in the mouth. It helps wash away food particles. It supports a healthier oral environment. It begins digestion, and it can make the mouth feel fresher after eating. So the benefit is not only the clove. It is the slow chewing, the saliva, the pause, that quiet moment after a meal when you stop rushing and let the body settle. If you choose to use 1 softened clove, chew slowly for about a minute. Then spit out the fibrous piece if swallowing does not feel comfortable. You do not have to swallow it to turn the ritual into something useful. Number 8, missing the cephalic phase signal. This is where the mouth and digestion connect. Before food reaches the stomach, the body can begin preparing. Taste, smell, chewing, and saliva are part of that message. That early preparation is called the cephalic phase. But let's be clear, this does not mean cloves are a treatment for blood sugar, reflux, or digestive disease. It means the mouth has influence. And when we respect that influence, we do not need to overdo it. A small signal is often enough. That is the point. Not stronger, not more aggressive, just enough. Number 9, forgetting the nervous system piece. Chewing is also connected to the nervous system, especially when it is slow and rhythmic. The part of the nervous system involved with rest, digestion, heart rate, and stress response pays attention to rhythm. So the way you chew matters. Sit down. Breathe through your nose if you can. Chew slowly. Let your jaw relax between bites. Do not clench. Do not rush. Do not turn it into another task. The nervous system does not respond well to force. It responds better to rhythm. Number 10, using cloves to cover bad breath without asking why. Bad breath is not always a spice problem. It can come from dry mouth, dental plaque, gum disease, reflux, sinus drainage, not drinking enough fluid, or medications that reduce saliva. So if you only use cloves to cover the smell, you may miss the reason it is happening. Cloves may help the mouth feel fresher for a while, but persistent bad breath deserves a closer look. The wiser question is not, what can I chew to hide this? The wiser question is, why does my mouth need help staying fresh? That question can lead you to better answers. Number 11, fennel seeds as a gentler after-meal option. This is the +1. If cloves feel too strong, fennel seeds may be a better fit. Fennel has a softer, sweeter flavor. It has a long tradition as an after-meal seed, and for women with sensitive mouths, it may feel gentler than cloves. Take a small pinch after a meal. Chew slowly. Then notice, how is your breath? How is your stomach? Does your mouth feel calm afterward? Or irritated? That is the real test. Not what the internet says. Not what worked for someone else. What your body tolerates. Because the best after-meal ritual is not the strongest one. It is the one your body can receive without fighting back. There is one real case worth mentioning carefully. A published medical report described a 8-year-old woman who had burning mouth symptoms for about 2 years. She tested positive for sensitivity to eugenol. The report noted exposure to eugenol mouthwash and daily clove chewing. After she stopped those oral eugenol exposures, her symptoms improved. Now, this does not prove that cloves are dangerous for everyone. It does not mean one clove will harm every person, but it does teach a practical lesson. The same compound that makes cloves feel powerful can become too much for a sensitive mouth. And after 60, many women are already dealing with dry mouth, dental work, thinner oral tissue, medication changes, or reflux. So the better question is not, are cloves good or bad? The better question is, how does my body respond? That is the heart of this video. A wise habit is not just natural. It is measured. It is flexible. And it knows when to stop. This is something I wish more people said clearly. For the next 7 days, do a gentle after-meal check. Not a challenge, not a cleanse, not a test of discipline. Just a check. If your mouth is healthy, your teeth feel stable, you do not have mouth sores, and you are not taking blood-thinning medication, you may try one softened whole clove after a meal. Not every day. Just 2 or 3 times in the week. Chew slowly. Then notice what happens. If cloves feel too strong, try a small pinch of fennel seeds instead. Track 3 things: your breath, your stomach comfort, and whether your mouth feels calm or irritated. If you take blood thinners, have active ulcers, have burning mouth symptoms, have significant reflux, or you are unsure about medication interactions, ask your healthcare provider before using cloves regularly. And tell me in the comments which one feels gentler for you after a meal. Clove, fennel, or neither. Your experience may help another woman make a safer choice. Because a small ritual should make your body feel supported, not irritated, not pressured, not overwhelmed. With cloves, the wisdom is not in doing more. It is in knowing when enough is enough.